something that should really tip you off that there just might be a serious problem with this baby's heart is if you see just left to right shunting either at the atrial level across the patent foramen ovale or at the ductal level. And we've already talked a little bit about right to left shunting at the ductal level, but let's touch on the atrial level for a minute. So if you see exclusive right to left shunting at the atrial level, it means one of a couple of things. It basically indicates that there's not enough blood entering the left atrium through the pulmonary veins to fill the left heart. And so the baby is having enough left ventricle cardiac output by basically drawing additional blood from the right atrium into the left atrium. And this can mean any one of a number of things, but specific entities that I'd like you to think of are total anomalous pulmonary venous return, where the pulmonary veins don't return normally to the left atrium, they actually return somewhere else, or tricuspid or pulmonary atresia. So if you don't have any blood flow that can go through the right ventricle out the pulmonary artery, the only way the blood from the superior vena cava and inferior vena cava can get circulated through the heart is by crossing the patent foramen ovale into the left atrium. And we'll go into those in more detail in a minute. When you see right to left shunting at the ductal level, it basically means that blood flow to the systemic circulation, the body, is being provided by the pulmonary circulation, or the lungs. So again, it's that same entity that we talked about before, where you see blood flow crossing the pulmonary artery into the ductus, into the descending aorta. And the two main groups of heart problems that can lead to this right to left shunting at the ductal level, one is that those left heart obstructive lesions that we talked about, critical or severe aortic stenosis, hypoplastic left heart syndrome, coarctation, or an interrupted aortic arch. But you can also see this in cases of severe pulmonary hypertension. So if the blood pressure in your lungs is higher than the blood pressure in your body, and you have blood flow going across a ductus arteriosus, the blood is going to flow from the area of higher pressure to the area of lower pressure. And so you will actually see blood flow from the right to the left across the duct.